This is Dr. 𝗕𝗏𝘯𝘊𝘠𝑟𝑒𝑑𝑦, Senior Brain and Spine Surgeon at Continental Hospitals, Hyderabad. The most common symptom of brain tumor is basically a headache, which is usually prolonged for around 3 to 6 months, continuous, sometimes on and off. Then when it comes to other symptoms, seizure, any epileptic attack a patient has developed, and sometimes even patients present with paralysis of one part of the body and continuous vomitings without any relief. So these are the most common symptoms of brain tumor. Yeah, so this is one thing which patients usually think is, if they get any kind of brain tumor, the only thing what happens is death. So this is the biggest myth, where 90% of brain tumors are non-cancerous. Usually there are two types of tumors, cancerous and non-cancerous. So 90% of the tumors fall under non-cancerous category, where we completely remove the tumor, so the patient can have a complete cure and live a normal life. There are only these 10% of tumors which are high grade tumors, which post radiation also have a very good life cycle and lifespan post the complete treatment and therapy. See, most of the pathologies with related to brain tumors and the types of tumors are having any kind of genetic association. There are very few tumors which will have something like post-traumatic development or any other reason as such. So 95 to 97% of the brain tumors are having genetic association with tumors running in the families with different kinds of organs associated. Sometimes patients can also have metastasis, means primary tumor being in some other part of the body and getting spread to the brain. The most common thing used for any diagnosis of brain pathology or tumors is a simple CT scan brain. If we detect something unusual in that, then an MRI brain with plane and contrast study and few other advanced technologies are used for detection of brain tumors to the maximum extent. There are different treatment options available for brain tumors depending upon the location of the tumor and the size of the tumor. If the tumor is very small in size, what we do is stereotactic radiosurgery, where patient need not undergo any kind of brain surgery. But when the tumor size is large and it's causing mass effect or other symptoms in the brain, primary treatment modality is always a surgery and complete safe maximal resection of the tumor.